Congenital scoliosis is one of the most easiest types of scoliosis to identify, and this is when a scoliosis actually develops in utero, and most likely it develops in utero as a result of a mouse-shapen bone. One of the vertebrae doesn't fully develop, and it develops into something called a hemivertebra or a blocked vertebra. And the bottom line, it's a misshapen bone, and this misshapen bone within the spinal column typically will cause a scoliosis to occur right at that area, and the patient is born with scoliosis. Normally, this is very easily identified by x-ray, and you can actually take an x-ray and see the bone that's not shaped properly, and then you diagnose the patient with congenital scoliosis. Now, whether you have congenital scoliosis or neuromuscular scoliosis or idiopathic scoliosis, a lot of times these curves are treated the same way. However, in congenital cases, if the malformation is significant enough, sometimes surgical intervention is done in hope to try to improve the mouse-shaped vertebra, but in a lot of cases they're not, because they're concerned about what could happen as a result of the surgery. So in many cases, they're monitored and treated structurally to the best of our ability. Congenital cases do have some congenital formation that is causing part of the scoliosis, but many cases of congenital scoliosis acquire more degrees through growth and development, like every other child does with idiopathic scoliosis. And normally, if that's controlled, we can limit the expression of the scoliosis only to the deformity as opposed to acquiring more through growth.